first of what we hope will be many Big Tent webinar sessions where we hope to focus on the new Medicaid changes that are coming and affecting our Medicaid adult expansion group, these new community engagement requirements. There are some new faces on the call today, so I do apologize if some of this information is going to be repetitive for some folks that have already heard some of this information, but just want to make sure all of us have kind of the same baseline of working knowledge moving forward. So we're going to talk really quickly about these new HR1 community engagement requirements and how we anticipate they're going to impact West Virginia, provide some updates as to the many activities the state has been preparing related to updates to systems and preparing partners and staff and members to embrace these new changes. And then we do want to spend a little bit of time to talk about this Big Tent webinar series, what we have planned, some special topics we're thinking might be useful for this group, and would really love some feedback from all of you to see if what we plan to talk about on an ongoing basis is going to be what's most effective and important for all of you, or if there are other topics or support you may need to help with getting this word out in communities and preparing members for these changes. So really quick, we're going to do just a quick primer on the community engagement requirements. So last summer, a law was passed, referred to as the One Big Beautiful Bill Act, or HR1, that made many changes to the Medicaid program. Today, we're talking about specifically the Medicaid changes that are impacting the adult expansion group, who beginning in January 2027 will have to follow work or activity rules to keep their West Virginia Medicaid coverage. So these go into effect starting in January, but the true effective date differs depending on whether you're a new applicant or an existing member. So for those that apply in January, the state is going to be looking retroactively, and I'll speak a little bit more about this in the next couple of slides, in December to see if they've met compliance. And for current Medicaid members, these new rules will go into effect starting with those who are due for renewal in March 2027, because the state initiates their renewals in January. Not everyone will have to follow the community engagement rules, as there are certain conditions that exempt individuals, and we're going to talk about that. I should have mentioned in the beginning too, please feel free to chat your questions, raise your hand for questions. I really prefer this to be a discussion and ensure that you're getting the information you need out of this, rather than just a straight presentation and ask. I'll try to keep my eye on the chat, but if others can kind of monitor and come off mute and tell me to stop talking to answer questions, I'd appreciate it. So yeah, let's talk a little bit about what these exemptions. So as I mentioned, not everyone will have to follow these new compliance activities every month. So I'm going to talk about the exemptions first. There are mandatory exemptions that states will not have the option as to whether they include those in their Medicaid community engagement programs. And then there are a listing of optional short-term hardship exceptions that states can opt to include. So the mandatory exemptions, I'm just going to provide, I kind of bolded the key ones there, and I'm not going to read them to you. You're going to get a copy of these slides in the recording, so you can always kind of go back, and our website has a lot of detailed information about this as well. But the state's going to be checking when folks apply or are due for renewal to see those under age 26 or who have recently aged out of foster care, individuals who are parents, caregivers, or guardians of a child 13 or under, or caring for a person with disabilities, a veteran with a total disability rating, individuals already meeting work requirements, or are exempt under TANF or SNAP. These are just kind of a couple of examples of the mandatory exemptions. Again, those optional short-term hardships, so states have the option as to whether they will include these as part of their Medicaid community engagement requirements. So these short-term hardship exemptions are, as the name suggests, intended to provide temporary coverage for folks that might be going through something that is not a long-term situation. So individuals who may be seeking inpatient care or outpatient care of similar acuity, a federally declared emergency, they reside in a county with a federally declared emergency or disaster, individuals who have to travel for care or are caring for somebody who have to travel for care. And if you reside in a county with a federal unemployment rate that is at or above 8% or 1.5 times the national unemployment rate. So all of these hardships we are still waiting for that final interim rule to be released by CMS to understand more clearly kind of the true definitions of these optional short-term hardship exemptions, as well as some of these mandatory exemptions and what the process will be for verifying them. The qualifying activity. So if the state finds that the applicant or existing member does not qualify for any of these exemptions or short-term hardship exceptions, they will have to meet one or a combination of these compliance activities. So employment, community service, participation in a work program, or to be enrolled in an education program, or again, any combination of these activities that total at least 80 hours per month. Alternatively, if someone is receiving a monthly income equivalent to at least 80 hours of the federal minimum wage or $580 per month, they are also compliant. So what changes will we see with the enrollment and eligibility process itself? So currently, members have to renew their coverage every 12 months. Under these new community engagement rules, that's increasing to every 6 months. And these new community engagement requirements introduce a look back period, which is also a little bit new. So for new applicants, the state's going to look at activity in the prior month of their application. And for renewing members, the state will review activities since their last renewal and ensure compliance for at least 1 month. So a couple of examples here, because this can get a little bit tricky to kind of think about, and it is different for applicants versus existing members who are renewing. So if a person submits their application in January of 2027, the state's going to look at activity in December of 2026 to see whether they met an exemption, and if they didn't, did they do that minimum 80 hours of some combination of community engagement activities to meet that compliance rule. The other example, let's look at a member who's due for renewal in July 2027. So if they're due in July 2027 for renewal, they must be exempt or compliant for at least 1 month since their last renewal. It can be any month since their last renewal. It doesn't have to be the one immediately preceding the renewal month. This just kind of summarizes to give you kind of a quick snapshot of what the Medicaid eligibility rules look like pre-HR1 versus post-HR1. So again, pre-HR1, there were no work requirements. So this is a brand new expectation and rule for Medicaid adult expansion members. And that retroactive time frame is also new. So prior, it was primarily just an income level that folks had to meet to be able to meet that eligibility. Now the state is going to be looking retroactively during a specific time frame called a look back to verify compliance with community engagement rules. The work exemption rules, of course, also were not applicable prior to HR1, but post HR1, there are federally mandated exemptions that all states have to comply with. The renewal frequency, again, prior, or currently, I should say, because we're still actively under the current rules, is 12 months. And under the new rules, it will be every 6 months for Medicaid expansion members. And then that retroactive eligibility, we're seeing some changes here too. So under the current rules, states are required to provide coverage for qualified medical expenses incurred up to 3 months prior to the date of application. Under these new community engagement rules, retroactive coverage is limited to 1 month prior to application for expansion enrollees and 2 months for traditional enrollees. So those are kind of just some of the key highlights to give you an understanding of how this program is changing under these new HR1 community engagement rules. So let's look at now, that's kind of your federal level primer and how this is going to impact our group here in West Virginia. So the Medicaid adult expansion group, we're talking about low income adults 19 to 64 who became eligible for Medicaid coverage under the Affordable Care Act. We're also including what we're calling the transitory group as part of those who may be affected by these new rules. And these are individuals who may soon transition into the adult expansion group. So these are individuals turning 19, women in that 12-month postpartum period that may be coming to an end soon, former foster care individuals turning 26, a parent or caregiver with dependents that are turning 14, and any other transitional Medicaid groups. So these groups we also plan to ensure we are reaching out to and communicating these new changes to as well. We're going to look at couple of slides here of some data points. So what this shows you is the number of Medicaid adult expansion members by county. We produce population impact estimates on a monthly basis. So this information is valid as of May 2026. So it's relatively current. Based on the data that we have, the total estimate of Medicaid adult expansion members is about 157,000 adults throughout West Virginia. And you can see kind of that spread by county here. We also pull out the top 10 Medicaid adult expansion populations by county. So you can kind of see which counties are carrying higher population rates than other counties. And when we see how HR1 community engagement requirements are going to impact that population, we take a look at this kind of decision tree we've pulled here, and I'll kind of walk you through this. So of that 157,000 Medicaid expansion members, the data that we have currently, so we use existing enrollment and eligibility data, we use Medicaid claims data, other data sources, such as data from the Department of Corrections, to really try to capture as many individuals who we think will qualify for those mandatory exemptions automatically. So based on the data we have today, we anticipate or estimate that about 119,000 individuals will be automatically exempt from community engagement requirements, leaving about 38,000 that we don't have data on to say that they will qualify for a mandatory exemption. Of that 38,000, 33,000 are not meeting community engagement requirements, leaving us with about 4,500 that say they are meeting community engagement requirements. We do have an asterisk here, and this is a really important note to take note of. So we check exemptions first. So there are a lot of individuals in this 119,000 that are meeting community engagement requirements. So this shouldn't be read as there are only 4,500 Medicaid adult expansion members who are working or volunteering, or some combination of that. So of that 33,000 that remain here, our data sources tell us that about 400 individuals will meet an optional exemption, leaving about almost 33,000 who do not meet a mandatory exemption or are not meeting community engagement requirements. So this is the population here that we are saying will most likely be impacted by community engagement efforts, which makes up about 21% of the total expansion population. If we take a little bit of a closer look at this impacted population here, some demographic pieces here, so age, race, gender spread, but also want to provide you a little bit more information on the top 10 counties that will be impacted. So these are percentages of, we take the total Medicaid expansion population within the county and determine the percentage of individuals who fall into this category. So you can see, for example, that Pocahontas County, 29% of their expansion population. Currently, we don't have enough data on to say whether they qualify for a mandatory exemption or are meeting CE requirements, which are about 202 individuals. So we provide that data for the top 10 counties. You can see that some of our higher populated groups that have similar percentages are going to carry much greater numbers. So Morgan has 25%, 316 individuals. Monongalia also has 25%, but a total of 1,445 individuals. So we can begin to use this information to help us understand collectively where we need to maybe concentrate or direct boots on the ground outreach efforts, and where we may need to ensure we're working with our workforce partners, our volunteer and nonprofit partners to really bolster up access to community engagement opportunities within these counties. And we do have this information for every single county. And that is a resource that we'll be distributing out to the group shortly after this session today as well. So you'll be able to see this breakdown here for every single county. So when is this happening? So these green little squares along the top here provide you federal deadlines that states have to comply with. And then these blue boxes here provide you insight as to where West Virginia is at or what their plans are to be able to meet those. So this very first one here, we are days away from CMS releasing its final interim rule that is hopefully going to clarify a lot of the gray that we still have around interpretation and application of some of the exemptions, the qualifying activities, those short-term hardships. So we will be planning an expeditious review of that final interim rule in June. In September 30th, 2026 is the latest states can begin outreach about new requirements. West Virginia is ahead of the game. They've started informal communication to members this month in May with a postcard mailing and have a formal notice planned for August. I'm going to pause there because I see your hand up, Rhonda.
Yes, thank you. The thing I wanted to mention was about the final rule.
Mhm.
So we are hearing rumors that the White House wants to restrict opportunities for self-attestation as well as definitions for medical frailty. And I know that much of the system that the state has been building and the communications that you have been sending out um, are built around the assumption that we will be able to have those. So I just wanted to, share that with folks and also ask if anyone has any connections with our senator, specifically Senator Capito, and would like to flex that relationship to ask that we continue to have access to those things. I think that would be really helpful, just given the timeline.
And Rhonda, I will add that we have built this to where we will rely very little on self-attestation. So we are really looking at as a last ditch effort. If everything else fails, we've built in a lot of automated processes, a lot of data matching, so that we don't have to get into that situation. But I agree. It is something that unfortunately for a very few small percentage may need to rely on that. So I appreciate that.
And Rhonda, this is Melanie Dempsey with the Hospital Association. We are actually going to be in DC for some meetings next week. If you want to talk a little more offline, that might be something we'll have an audience and can have a conversation about.
Thanks, Melanie. I'll connect with you
Okay.
offline.
Thank you, Rhonda. Thanks, everybody. And then, as I mentioned earlier, January is when those requirements go into effect. So for applicants starting January 1, and then using that December look back, and then for existing members beginning with those who are due for renewal in March 2027. But how is the state preparing? So a couple of different ways. So obviously looking at policy, interpreting policy, defining policy, all of the system updates and procurement of new systems that are needed to be able to meet these requirements, preparation of member-facing staff, helping them understand these new requirements and the support that they'll be expected to provide members, as well as how to navigate changes to the enrollment and eligibility process. All of our partners, all of you, and the many more we hope to bring into this group to ensure a well-coordinated statewide effort, and then our members themselves, of course. So policy readiness, as I mentioned, couple days away, hoping it's on time for that final interim rule to be released. This is again, of course, when when CMS will tell states how to turn the statute into final operational systems and eligibility rules. So this hopefully will help clear up a lot of the gray that we're still experiencing in some areas. We've developed a community engagement policy playbook, which is a resource that is intended to ensure consistent interpretation and application of these community engagement requirements, including plain language recommendations that you all may use for outreach materials. So this resource is currently live internally within the Department of Human Services, and we will have a version of that available for external partners after the final interim rule posts, and we're able to kind of update all of our information with more accurate details. So that will be another resource that will be available to all of you soon. Systems readiness. So a lot of updates being made to the People's Access to Help or PATH system, that is the state's enrollment and eligibility system, procurement and implementation of a SaaS application called Verify, which will be responsible primarily for the community engagement requirements verification process. And then procurement and implementation of a closed loop referral provider. So now that members have to engage in these community level qualifying activities, if folks are not meeting those requirements, really want to be intentional about providing direct referral to opportunities within their communities, so that that data can be captured, reported back, and can help individuals continue to access coverage. And then the point that Sarah was speaking to, really enhancing the automation capabilities, putting a lot of effort there. And we've introduced usability testing as well. So making sure that real members and real caseworkers have a seat at the table as we're talking about these system changes, and making these system changes, because they are the folks that will be using them and impacted by them at the end of the day. So helping them, allowing them to help guide the development of some of these changes as well. Here's that automated verification flow that Sarah was speaking to as well. And you'll see that again, self-attestation is a very last attempt. So what the state will be doing first is checking all data sources it has access to see if individuals will qualify for a mandatory exemption. So we'll be using Medicaid claims data, PATH enrollment data, Department of Corrections data, Department of Veteran Affairs data. These are just a couple of examples. If those attempts return nothing, or not enough information, it will then check data sources to see if they're meeting qualifying activities. So income data from the Federal Data Services Hub, the National Student Clearinghouse data for Enrollment and Education Program, Workforce West Virginia for employment and hours worked, Volunteer West Virginia, just again, a couple of examples of data sources. If the automated efforts, again, do not return enough to be able to verify, that is when the state will engage members and request documentation. This could be pay stubs, volunteer hours log, for example. And then after that point, that is when self-attestation may be accepted for certain activities or conditions. This provides you a little bit of understanding of how folks will kind of be working through the enrollment process. So this first one provides the workflow for someone who's applied. So once they submit their application, again, the state's going to look at the month before the date of their application. If they're able to verify based on the data or information that's shared, that person will be enrolled. If not, the individual will receive a notice of noncompliance. The individual will have 30 days to show compliance. And if they're not able to demonstrate compliance within that 30 days, they will be notified that their application has been denied, and that person will have to reapply and go through that process again. However, if they were verified and they're enrolled, then they will be an existing member that is then on that every 6-month re-verification cadence. So every 6 months, the state is going to use the existing data it has on file, check that it's still active and relevant, and will look back 1 month since their last renewal. If it's verified, enrollment's maintained. If not, that same cycle, right? So they'll receive that notice of noncompliance, have 30 days to show compliance. If they're unable to do that, they'll be disenrolled and have to reapply. So that kind of gives you just a very high level picture of what that process will look like for applicants and existing members. So showing what this journey will look like to maybe two theoretical examples here. These are not real people. They're just personas we've developed. So taking this as an example of a member journey for a new applicant who has to meet qualifying activities. They don't qualify for an exemption. So this is Bill. He's a male in his mid-30s. He's from McDowell County. He works 10 hours per week at a grocery store and earns about $376 per month in income. He has a smartphone and can navigate a portal with some effort. He was at his local pharmacy picking up prescriptions, paying out of pocket, and Bill learns from the pharmacist that he may qualify for Medicaid. The pharmacist gives Bill a postcard with a QR code that takes him to PATH. So Bill decides to hop on, complete an application. Path determines Bill's not exempt and needs more information to determine compliance. So Path engages Verify, that second system I spoke to run its data sources automatically to see if it has enough information on Bill to say whether he's meeting community engagement requirements. It does not, so Verify reaches out to Bill and requests for more information because Bill's short on hours, right? He needs at least 20 hours per week or 80 hours per month. So there's a couple pathways this can go. So at this point, Verify will refer Bill to a closed loop referral provider to make sure he's plugged in and has access to find qualifying activity opportunities within his community. Meanwhile, he will also be requested to provide documentation. So Bill provides that documentation that proves compliance, and he's approved and on track for that 6-month renewal, or he cannot prove qualifying activities. It's a situation where self-attestation is not accepted. So Path sends Bill a denial notice informing he'll have to reapply once he completes some of these activities he hopefully found within his community. And this is another member journey. So this member journey looks at an existing member who is currently exempt from community engagement requirements. So Brooke received coverage for pregnancy and postpartum care and now qualifies under the Medicaid expansion. She's a female in her mid-20s from Putnam County, a mother of a 2-year-old girl, has a smartphone and is used to navigating the portal easily. She's used it before. She's a standard expansion enrollee, and the system has an exclusion flag present, which means the system already sees that she's excluded or exempt, and that information is still active. So she's due for renewal in March. Brooke doesn't have to do anything. Long as that exclusion flag is present, we're going to run the data sources, ensure it's still active, and Path verifies and lets Brooke know after the fact that she's exempt from those rules and her coverage will continue. And that process will continue every 6 months until, of course, that situation changes. So those are just 2 examples. I could probably run you through 15 more because we know that this is not a one-size-fits-all journey. Staff readiness. So what the state's doing to prepare its staff, intensive training over the course of the next 6 to 8 months here. So hosting a number of informational live sessions, self-directed trainings and knowledge checks. We've recently developed and released a toolkit for all member-facing support staff. So DOHS staff as well as our MCO partners who manage call centers and field a lot of questions from existing Medicaid members as well. That have some information about these new rules, call scripts, a pre-screening tool that helps them navigate members to understand if they'll be potentially affected by these changes, and copies of the outreach materials that the state has been sending members. We've been conducting caseworker interviews and ensuring feedback mechanisms are in place to make sure that these materials we are developing and using are actually relevant and effective. And we'll be using an iterative process to improve those as we move forward. And here's just a couple of snapshots of those resources. What we are doing and hope to continue to do to prepare our partners and work closely with our partners to support members as well. All of our community-based trusted voices and qualifying activity providers, all of you, and hopefully others within your network that you'll extend this invite to and ensure are participating in future sessions. So we really look to lessons learned from the unwinding, adopted what worked and maybe paid caution to what didn't work. We conducted a statewide environmental scan that helped us understand who all of these key trusted voices and qualifying activity providers are, and are working to invite and engage these individuals to partake in this opportunity moving forward, hosting these monthly sessions and developing toolkits that are tailored to partner type. These are in progress. These will not get released until after the final interim rule. We just felt that's probably more productive and not have to kind of go back and redefine or clean up information that we may have shared prior. So these are slated to release early August for everybody. And then really working collectively with everyone here to achieve this statewide coordinated effort. So really working to expand this network, this group, and work together to ensure timely and most importantly, consistent dissemination of information. This is just a very high level snapshot of some of the, we're going to share like a little bit more of an extensive listing of organizations that we found from the environmental scan. But the two primary groups, partners that we've identified here, there are three, truly three, but our member facing support staff and outreach partners, so our MCOs, our DOHS county office workers, and the Office of Constituent Services. Our community-based outreach partners, so all of our partners within the healthcare delivery system, navigators, faith-based organizations, Medicaid advocates, and healthcare associations. And then this other group, we're calling this qualifying activities and support services providers. So these are all of the organizations that we hope we can work with to ensure members have access to qualifying activities. So access to work opportunities, volunteer opportunities, educational and training opportunities. What we're doing to prepare members. So currently the Department of Human Services has a communication plan that's been deployed currently in phase one, as well as CMS has a communication plan that they've extended to states that the state of West Virginia has opted into as well. We know our MCO partners are working on a communication plan as well, and leaning, of course, on our Beneficiary Advisory Council for ongoing input to ensure what we're developing is going to resonate. I'm not going to go through this in great detail, but this just kind of provides you some information as to the Department of Human Services communication campaign. Again, just want to concentrate that we're currently in this phase one. The goal for phase one is really to ensure education and awareness building. We just want to make individuals who are likely to be affected by these new rules aware that these changes are coming and help them understand what these changes mean. So we have an informational website launched, a series of print and digital mailings that are going out and robocalls that'll see us through the first week of July. That formal notice going out in August, as well as some other informal messages that we'll add to here. But we don't want to inundate members because this is when that early awareness communications campaign will be running from CMS. So that's going to be a July through August campaign. And then as we get closer to go live, really boosting engagement, really pushing boots on the ground efforts, and specific calls to actions to ensure community engagement readiness among members. So here's that informational website. This is going to provide you a lot of information, encourage you to kind of scan that code if you have your phone close by you. You'll receive this presentation deck, and these are hyperlinked as well, so you can kind of go in and click these links if you'd like as well. But the website is intended to provide a lot of good information based on the information we have today, which I think is really important to know. So as the interim rules release, we're going to have to go back and refresh that content, expand our FAQs, define areas a bit cleaner. Postcard went out to about 140,000 members that hit mailboxes last week. And here are some of the other informal communications we have planned through the first week of July. Here's that toolkit again, another QR code if you want to scan that. You'll be able to get to it if you're already on the website, but really want to call attention to the FAQs page on the website that provides just some basic answers to some frequently asked questions that we've been receiving, we anticipate you're going to receive as you engage members or that you may have yourself. And another QR code up here that if you scan will take you to that pre-screener tool I talked about. So even though we're kind of positioning these as resources for member support staff materials, all of these materials are relevant for anyone and available for use on the call today as well. So how can we coordinate our efforts to best support those affected? And this is what we really kind of wanted to get to. So this Big Tent webinar series and what we're really hoping we can get some feedback because we do want to make sure that these sessions are positioned to be actionable and effective and achieve what we want to achieve at the end of the day. What we hope to accomplish, and we hope you share this mission. If others have other thoughts or ideas for what we might be missing here, please feel free to come off mute and share with us or chat. But we hope to accomplish as a group that the work that we do together helps members understand the changes that are coming, ensure that we can effectively communicate them, and how we can coordinate our efforts to protect coverage and expand access to qualifying activities. So that's kind of hopefully our collective charge, if you will. So some of the activities we have planned, again, these monthly sessions where we plan to coordinate closely with Rhonda to bring in subject matter experts covering different community engagement topics where we can do deeper dives into the different areas of it. Provide you ongoing updates on how the Department of Human Services is preparing for implementation and updated information specifically related to policy. And then making sure this is a space that everyone has access to outreach materials, webinar recordings, and other resources we will be developing and disseminating to the group, and invite others, of course, to develop and disseminate to the group as well. There will be a space on the website, the DOHS Community Engagement website that you just scanned, if you did, that will have access to all of these resources as well in the coming months. And we also see this, of course, again, as a space for actionable opportunity for community level organization and impact, and have been working with our MCO partners to see how their health funders work group can potentially be a space where a lot of the things that we talk about today can be workshopped in that space and taken action upon. So excited to share a little bit more on that. So here's a sampling of these monthly topics. I saw a question about presumptive eligibility in the chat, and this is something that comes up a lot. So we think a special topic on presumptive eligibility and the CE requirements would be helpful to include, perhaps a special session on understanding exemptions. So really doing a deeper dive on these exemptions, particularly medically frail, which is probably the most difficult one to really kind of grasp and wrap your arms around. Deeper dives into employment, training, and volunteering. So how can we begin to build this qualified activity network or expand upon what already exists, leaning on the data sources that we have and understanding where those kind of hotspots might exist around the state. Member outreach and provider engagement. So how we really work together to ensure that cohesive, consistent communication standard, and how we train others we work with who may be frequently engaging with members in those spaces. And then here are just some other topics. I'm not going to read through these in a more detailed way because we think that these might be perhaps a little bit less of interest other than this one, which is of high importance, that building local community engagement requirement networks. So really working to figure out how we mobilize at the local level. So I'm going to pause there. I need thoughts, feedback on how we hope to structure these monthly sessions. Do these topics resonate? What other information or activities would be helpful? Any topics really stand out? That's like, can we please plan this for June and July? We have some proposed topics there.
Two questions in the chat. One is related to the question you just asked, which is what time frame would we start providing webinars?
So we see this one as the very first one and continuing on a monthly cadence via this Medicaid task force group. So I believe they would be towards the end of every month. And then probably running them, we anticipate at least through go live, but there may be need or interest perhaps to extending them maybe through the first couple of months of go live if we kind of want to monitor and see where we might want to concentrate effort. But we're planning till at least January.
And then the other question is more related to, the subject matter. How do family caregivers qualify? Is there a mechanism for people without access to the internet?
Yeah, so I might look to Sarah for that first question. How do caregivers qualify?
Yeah, so for caregivers of children 13 and under, if they live in the household and we already know about them, we'll be able to pull that from the data system and automatically apply that exemption. But for caregivers of older, maybe children with disabilities that live in their home or individuals that don't live in their home, they will need to claim that exemption. So they'll need to tell us about that. And then we're working through how you would verify that. So if it's someone that they have medical power of attorney, some other like legal mechanism that would prove that they're a caregiver. And if not, we'll look at, maybe a self-attestation, a written statement under perjury, something that would hold up to documentation. But we don't anticipate it being too cumbersome in the documentation. Does that get at what you're asking, Sally?
Sorry, yes. Um, yes, I just was wondering how that would be verified. There's so many people who do family caregiving for older adults or disabled individuals.
Yes,
Uh,
and if that individual is capable of verifying the statement, they could do that themselves. If they are, not competent we would look for some outside verification of that situation, but looking to make that as like I said, least cumbersome as possible. And then you asked about those without access to the internet. So we imagine that they'll follow the same process they do today. So all of this can be handled through the county offices or through our call center. So, although we do have an electronic platform that individuals could use themselves, the caseworkers can also help the person use that. So, even through, I imagine the closed loop referral, working with 211, they have individuals that can help people navigate that by phone. There's other ways that they can interact with that as well. So we're looking, through people, currently don't have internet access and they're able to apply for the program. So we're looking to make that as seamless as possible.
Thank you. Those are just two issues that are really cogent, I think, in West Virginia.
Agree.
And I was concerned if the self-attestation goes away, that might make it difficult for a lot of women, especially who end up being caregivers at earlier ages.
Yeah, and I think that there are ways around that. If that becomes a situation, I think that we can, get statements that are verified, that would stand up, that don't rely on just self-attestation. But we'll cross that bridge when we get there.
Okay, thank you very much.
Thank you.
Yeah, another question from the chat. Sorry, that Sherry Farrell asked a question for you, Sarah. Did you say that 211 was selected as the state's closed loop referral system?
And yes, so we're working with them currently. They have a great network. They currently operate in this space, and we are looking at how to operationalize seamlessly so that the member doesn't have to log into three different portals, or we don't have to do cumbersome file transfers or anything like that. So we're just working through the technical part of that, but that is our intent to work with 211.
Okay. Other questions, feedback, information that would be helpful, resources that would be helpful moving forward?
I will send out the list of proposed topics to folks and then just solicit any feedback and share that with you. For folks who are interested in being on the email list, there's a link in the chat now to a Google form. If you fill that out, I will make sure that you get on there. And if you've already done it, no need to do more than once.
And I'll say that there was a question about the county level data, which we have that. We're also looking at anticipating how many individuals will be due for renewal each month so that we have a better idea of what that impact might be on a monthly basis and how many of those individuals we believe to already be exempt or compliant, and kind of break it down not just on a county level, but on a monthly basis as well, as best as we can.
Sarah, that flags for me. Will you all be producing monthly reports to share, what's going on?
Yeah, so I think, we'll know more June 1, hopefully. We anticipate that CMS will require reporting, I would imagine, similar to what we did during the unwinding. If not, we are looking at metrics that are similar to those unwinding ones that we provided and would provide them in the same mechanism. We currently have those still on our website. We're still reporting those on a monthly basis on our website. So when you look at our website, it's kind of bare right now on the DHS landing page. But when you go to the larger page, there's a ton of information. But we anticipate on that main state page posting more of the reports that I know you love, Rhonda, and sharing more of that, again, the county level data, maybe even the monthly level data to begin with, and then the reporting metrics once we know or figure out what that's going to look like.
Awesome, thank you. And I'll share an updated, I guess, consolidation of the monthly reports that y'all have been producing since the unwinding for anyone who's interested in digging into that.
A couple more questions coming through the chat here. One from Christy Walker. CACs will still be able to enroll like we do now, correct? And will the 90 look back for claims change to the 30 days to align with the work, et cetera, compliance timeline?
Not sure I understand the first question. Christy, are you able to?
Yeah, so CACs, we're certified application counselors right now, are eligible to, like, we enroll people in Medicaid. We have case managers that do that for us. We have over 30 CACs. Will we be still able to do that?
Yeah, so
Okay.
it'll have the added layer of the exemptions or compliance, and we'll need to figure out how best to address that, but we don't anticipate any changes in that.
Okay. And right now, Medicaid looks back 30 days or 90 days for claims. Once someone has enrolled in the application, you click that option. Is that going to stay the same, or is it only going to get looked back 30 days for claims since the compliance is also looking back 30 days?
So maybe two different topics, or maybe I'm looking at it a little different. So the claims that we're going to look back for medical frailty, that can go up to like 2 years depending on what the condition might be. So as far as retro eligibility for the program, that also changes with HR1. It's separate from the community engagement requirements, but it is still part of that HR1. So I don't think we had a slide on this, but currently, like you said, so we can approve if you apply in this month, we can look back 3 months and see if you're eligible in those 3 months and provide retroactive coverage. That does change for this population, well, actually for all populations. So it's now limited to 1 month look back for the expansion population and a 2 month look back for all others. And I apologize for using look back. It's more of a retro eligibility period. So it's 1 month for expansion and 2 months for actually CHIP, which is new, and for all other Medicaid populations. Is that what you were asking?
Yep, that's it. Thank you.
Thank you.
Great questions. Any other questions or feedback? I think we're just at about time. I'll turn it over back to you, Rhonda.